Bismillahirrahmanirrahim. Continuing with topic of drowning, this is the ninth lecture and we'll continue with the internal autopsy findings in drowning. There are other signs and we'll discuss the medico-legal issues in this lecture. What are other signs which can be found on the body? The temporal bones should be examined, as a significant number of drowning victims show hemorrhages in the temporal bones. In order to establish drowning as a sole cause of death, it is essential to rule out any disease process that may contribute to death. Any fatal trauma to the head or neck may cause death without any visible injury. Similarly, the toxicological analysis should be done for the estimation of alcohol, sedative, and epileptic drugs. Now, regarding the medico-legal aspects, whether this was due to drowning or not, that is, the death was due to drowning or not, and if the death was due to drowning, then whether this was suicidal, homicidal, or accidental. Then we have to determine the time since that since how long the body has been remained in water. Now, regarding the death was due to drowning. It is common to kill a person or poison a person and throw the body into water to conceal the crime. In a typical drowning, there will be fine froth at nose and mouth. Material will be grasped in the hands, the clenched palms, which is cadaveric spasm, and the froth will be found in the respiratory passages. The lungs will be edematous, detection of diatoms, and these signs are seen in the fresh bodies. If the putrefaction sets in, then the diagnosis is difficult. Now, whether this is suicidal, homicidal, or accidental, the appearance of the drowned body will be the same, whether it is suicidal, homicidal, or accidental. Whether the disease jumped in, fell in, or was thrown in the water, the finding will be the same. Circumstantial evidence will decide the case. Now, in suicidal cases, it is fairly common amongst females, especially in towns which are situated near the rivers and canals. And women usually make sure to die. She will tie up her clothes in such a manner that her private parts are not exposed, even after death. A determined suicide may even tie himself or tie weights with the body before submersion, or may take some poison or cut his wrist or throat and then jump into the water. However, in such cases, the body is free from other kind of injuries which normally indicate assault. Now, regarding the homicidal drowning is rare, except in infants and children. An adult may be stupefied or overpowered and then thrown in the water. Other injuries may also be found in homicidal cases. Now, regarding the accidental drowning is quite common, and it is seen in children, bathers, fishermen, dock workers, intoxicated and epileptic persons. Injuries may also be sustained during the accidental falls. Now, regarding the time since death from drowning, unfortunately, the time since death in bodies recovered from the water cannot be fixed. The longer the time between the death and examination, the greater the latitude will be allowed. A close examination can avoid inaccuracies. For example, there may be some evidences like a watch may stop, which gives an indication of the time. Some show date also. The temperature of the body falls rapidly. As per Casper dictum, the rate of cooling is twice in water as compared to air. Rigor mortis sets in early. Wrinkling of the skin starts appearing shortly after immersion. Bleaching of the cuticle in 12 hours and the sodden appearance in 18 hours. Then the floating of the body due to accumulation of putefactive gases occur in about 24 hours in summers, and it may delay up to 2 to 3 days in winters. Fleas are drowned in about 24 to 27 hours. If any of these insects are found on the body, they should be placed under the watch glass and observed. The majority of flies die within 12 hours, but a few may live for more than 48 hours underwater. Putrefaction first begins in the upper part of the body. It is slowed down as long as the body is in water. But once the body is brought out of water, it sets in rapidly. Skin of the hand and feet become loose and peels off like gloves in about 2 to 4 days. Adipocere formation may take place in about 5 to 15 days. Now, what will be the difficulties in diagnosing death from drowning? Difficulties in diagnosing will be when the signs of drowning are absent, when the injuries are found on the body, and when the body is in decomposed condition. Absence of sign, the signs of drowning are absent in bodies that are recovered from water when, if the person is dead of laryngeal spasm, if the person was killed and thrown into water, if the body is decomposed, then minimal signs are found in submersion of an unconscious. Then regarding other injuries, they are found on the body, recovered from the body, it naturally will arise suspicion. There may be suicidal cuts, homicidal injuries, and injuries sustained during accidental fall. It should be remembered that the injuries may have been sustained before or after or during drowning. Although the injuries sustained before and during drowning are antemortem in nature, but they do not show ecchymosis because the blood will be continually washing away by the water. Because they are continuously being washed by the surrounding or flowing water. A microscopic examination is therefore necessary. Then injury sustained after the drowning, the most common injuries which are sustained after drowning are those caused by fishes, frogs, crabs, and other animals, or by passing boats. Animals attack the projecting part of the body, the eyelids, nose, the ear lobules, fingers, and the scrotum. The distribution of injuries and their post-mortem in nature and the nibbled margins help in diagnosing of such cases. Then in decomposed bodies, when the putrefaction sets in, the signs of drowning are masked or entirely obliterated. The fine froth is replaced by blood-stained putrefactive fluid. Lungs undergo softening and the blood-stained fluid accumulates in the pleural cavities. Stomach is usually empty and the contents transuded out or forced out. In early stage of putrefaction, the diagnosis of drowning is possible in some cases. Fine froth may not be present in nostril but may be found in trachea. Aquatic material will be found there. However, in advanced cases of decomposition, drowning cannot be diagnosed only on the presence of aquatic material in the upper respiratory tract. In such cases, the viscera should be sent for chemical examination. Diatoms resist putrefaction and their presence, especially in brain and bone marrow, provide valuable evidence of death due to drowning. The chemical examination of viscera may provide evidence regarding poisoning. In case of negative chemical examiner report, negative diatom test, the cause of death cannot be given. Thank you very much. This is all about drowning.